Hi, everybody. Can you hear me? I was worried I was in the wrong place.
Yep, I can hear you.
I have a question.
You're outside making everybody jealous, Linda.
I know it's gorgeous out. Hey, so do I actually introduce like Emily and then Kathy, or do they just come on? Seems like it would save time if they just came on and introduced themselves when they're supposed to, like Emily at slide 6 and then Kathy coming in on slide 8, etc.
Yeah, Linda, it doesn't look like Natasha's here, but this is Jenny from Waikoa. We haven't been doing that. We just say their name.
Okay, hang on. I'm going to interrupt you guys because I'm really confused. I just got a text from an email from Natasha saying, can you confirm we're in the right Zoom meeting? So are there more than one links running around?
No,
you know, I
none.
had.
Nope, I just forwarded it to you and you opened the meeting, so you're good to go, Rebecca. Thank you.
Okay,
I think it might have been me because I was in the waiting room for like 5 minutes and I was worried that I was in the wrong place. So I sent off this kind of email saying, am I in the right place?
Okay, I will just fine. Sorry to interrupt. You guys can move forward.
Okay, so I should introduce, is that what you're saying?
Well, it looks like Natasha is maybe
I'm on, Linda.
Gungeon today.
Hi, Linda. You can just transition and just say now we have Kathy or Emily when the time comes.
Okay, I will do that.
Hi, this is Kathy, and I'm just doing a sound check.
You're perfect.
Awesome. Thank you. Hi, everybody.
Same thing for Emily here.
You're good.
Do you want us to do any sort of intro of our background, or I know we're keeping mine super brief, credentials or background or anything like that, or just leave it what it's on the slides?
Well, that's where I was thinking that if you guys just knew when to come on, I wouldn't have to say anything and you could say, good morning, I'm Emily, or good afternoon, whatever it is. I'm Emily Burton from Mountain Pacific, and then just go right into your talk. And the same way with Kathy. And then that way we wouldn't have to spend that time on transition.
Works for me. Then I'll
Because
just pass it to Kathy after I'm done with slide 7 into 8.
Right. So as soon as you're done, Kathy comes on. Emily, you come on right after the poll questions. So as soon as the poll question is closed, and then do I ask to close the poll questions, or do you just automatically do it?
Queuing's always helpful, Linda. Just in case. And welcome. I think we have others who are joining us, so everybody welcome, and we'll actually begin in 3 minutes now. So
who's doing the poll questions?
Rebecca, that is in the screenplay that I'm hoping that you received from Gungeon and the team.
Nope, sure did not.
Okay.
But it just sounded that somebody else is doing the poll questions, not me?
No, it should be you, Rebecca. I can send those to you. I'll send that to you now, Rebecca. Apologize for any confusion.
It's okay.
Good afternoon, everyone. Welcome to our third of 4 sessions on building resilience. Today,
Looks like we lost Linda right at the beginning, but I'll step in for Linda as she's frozen. Welcome everybody to the Building Resilience, Maintaining a Quality Care in Nursing Homes during COVID and Beyond.
our session is building resilience, maintaining.
Oh, there's Linda, she's back.
Did I freeze? I am so sorry. I will
That's
start.
okay, Linda. Go ahead.
Good afternoon. My name is Linda Edelman, and I am the director.
It seems like Linda may have frozen again. We're here in the third out of 4th sessions, and it'll be covering team resiliency. So we're excited for you guys to join. You saw in the chat to please provide your name and your.
Today we are about team resiliency. Next slide, please.
Linda, you are still frozen, so I'll have you go ahead and turn your camera off to see if that helps with your audio being a little bit delayed. There we go. Now go ahead and give it a try. You turn your camera off again if you don't mind. I think it might delay again. Okay, looks like she's still a little frozen. So while Linda gets back connected, we just wanted to share this slide to remind everybody that. Oh, sorry, Linda. You're still frozen, so I'm going to go ahead and advance through these slides to the recap for you since you're having some technical difficulties. That'll give you some time to get that figured out, but I would turn off your camera for now. This is a consortium of a bunch of different organizations. We have the University of Wyoming, the Wyoming Center on Aging, Utah Geriatric Education Consortium, the Dakota Geriatrics Team, and the University of
Natasha, you muted.
Thank you. For opportunities, there we go. What we ask for you all is to make sure to take a look at those microburst videos that you have been listening to that have been sent out via email to learn about the topic that we'll be discussing during our flipped echo session. We'd like you to share your experiences. So when we go through our case scenario and when we have our open session where we ask you to share your stories, we want to hear from you, the nurses' aides, the nurses and the providers, to get feedback from your point of context as you work through some of these opportunities that we provide to you during these sessions. And lastly, we'll go over a QAPI project because we'd like to use these sessions to identify opportunities to work on a QAPI project and really choose something that's realistic for you and your organization. For our agenda today, what we'll do is we'll summarize the microburst video on team resiliency, which should take about 5 minutes, conduct a case study, which Kathy Owens will be going over and Emily Burton, and then use team resiliency for QAPI project. And then we'll stay on for an additional 30 minutes for optional discussion. So if you have some things you'd like to hear from the experts for their opinions on challenges that you may be facing regarding your teams or individual resiliency. Next slide, please. So we'll start with our poll question. Thank you, Rebecca, for launching that. So the first one is, I listened to the pre-recorded presentation about team resiliency. And this is helpful for us because we want to make sure that we give you information that's pertinent to you and your teams. And the second one is, the presentation was informative. And the last question is, the content was relevant to my life or work. So we'll give everybody just a minute to go ahead and answer those questions. And again, if you're typing into chat, thank you. Please continue to type into chat your name, the organization that you're a part of. And then as we work through this presentation, if you have any insight or if you'd like to come off of mute to add any additional information to the conversation, we welcome that. Okay,
and Natasha,
Linda, are you back?
I think that I'm back. I think that my computer overheated sitting out in the sun. So I apologize to everyone about that.
That's a-okay. We know how it goes. That's why we've got the processes in place for backup. So thank you, Linda. I'll hand it off to you. And I think Emily Burton will be doing a recap on her microburst session. So we'll transition it over to Emily. So thank you, Emily.
Hi, everyone. Thanks for letting me be here today. I'm Emily Burton, a registered nurse, and I'm a certified health coach. I work at Mountain Pacific here as an account manager, and I'm happy to talk with you all today on team resiliency. If you think about the jobs you've held in the past over your career, the ones that are probably your most favorite are likely because of the people that surrounded you in that job that really made a difference. Matthew Woodring Stover said, if you take the team out of teamwork, you just have work. And I don't think any of us want that. So a high functioning, successful team is simply two or more people that are working towards a common goal, that share core values, principles, that drive their actions. And some of those are honesty and effective communication. Being part of a highly functioning team shows improved clinical outcomes for residents, and the staff experience an increase in empowerment, reduced staff turnover, improved resilience. So how can we develop a team culture that is this successful? Next slide. One strategy to develop team building culture is really depicted in 5 pillars that help support the team. And those are transparency, confidence, trust, cohesion, and sacrifice. Too often organizations really tout being transparent, but really fail to put that truly into practice. Transparency has to start with our leadership, and it's imperative for all of our team members to really feel like they can be transparent as well. One intervention that I've heard of to elicit team involvement is really participating in stay interviews. So instead of having to recruit new people, you actually interview the people that still work there to see what are their pain points, where do they feel like there's opportunity for improvement, and what do they feel the team does really well. So confident leadership is really contagious, and it affects staff, and it helps improve communication with residents and their families, which in turn is shown in studies to have fewer adverse events. So really encouraging your staff to work at the top of their certification or license really maximizes that team engagement and offers a sense of pride in the job well done. Both transparency and confidence lead to trust and cohesive teams, which are work together to achieve those shared goals. And finally, sacrifice, which is kind of a little bit of a touchy subject after COVID and mandatory overtime and the short staffing we've all experienced. And it really needs to be freely given and not demanded. The sacrifice happens when the team values the kind of care that you provide and you feel really attached to the residents and one another. And when employees feel like part of a team and they feel valued, really become invested in the success of the facility. So it's a little bit of a background. Later in the presentation, I'll review a few examples of engaging the team in creative ways to build that resiliency. And with that, I'll turn it over to Kathy for the case study.
Well, thank you so much. That was very helpful and a great recap, Emily. And welcome everyone. I'm Kathy Owens. I'm a master's prepared nurse, and I have worked in executive roles in large organizations that support skilled nursing, post-acute care for our seniors and vulnerable residents throughout the country. So I'm so excited to be a part of this. Everything that we have been reviewing is just so salient to the work that we do every day. And I'm so excited that all of you have joined. In the past, we talked about generic resiliency. We had a case study, and then we talked about individual resiliency. And today we're going to talk about team resilience. Next slide, please. So let's visit a team, and I want you to think about what's going on with this team. So Keely is the manager of the Foothills Neighborhood Unit in the Black Hills home. She is aware several staff members are working extra shifts, balancing a lot of personal responsibilities, which we know a lot of our team members have many responsibilities at home, many stressors. Keely, as the manager, has noted that there's been an increase in the number of resident concerns. And she's also starting to notice that the staff are having some increase in interpersonal conflict. There has been a staffing shortage, which we're all so painfully aware of, and the home leadership is very actively engaged in recruitment strategies to help address these challenges. So that gives you the scenario of what we're looking at, and these could definitely be some signals, right, of stressors for the team. Next slide, please. So what we'd like to do today is use this as a jump up point to hear from each one of you, to hear, I want you to think about, based on everything we've been talking on resilience, based on Emily's review of resilience culture, what additional next steps do you think Keely and her team could take to build and support resilience of this team? So let's take a second. We'd love to hear from you. We'd love for you to unmute yourself and actually feel free to share verbally. We've also had quite a bit of success of hearing from our participants in the chat box, and that we also encourage. It's just we've so enjoyed the interaction that you all provided. Linda is saying she agrees about the microbursts, especially appreciated the suggestions for providing a buffer between work and home and work. That's so true, Linda. Very good. Excellent. Anyone else have some thoughts about what additional next steps could Keely and her team take? Just thinking about the scenario. Natasha's recommending that having time for team building and team relationship building could really actually help the team. That's a great idea, Natasha. And that can happen in a number of ways. We'd love to hear from you all on how that can happen. We've talked about huddles in the past, and developing huddles to help support our team members is an opportunity for building relationships. I think it was also a PDSA cycle during one of our sessions. So that could be an example.
And Kathy, one thing I love about the idea of huddles is to also include some gratitude within those huddles, and starting with three gratitudes or three things that you're grateful for, either for specific people that are on the team or just your workplace in general.
That's an excellent point, Linda, and a great reminder on the importance gratitude plays. It's so often, I know, being a nurse myself, we get very task oriented, and there is not a lack of things to do, which we're also aware of. And so I don't know about you guys, but if I have like a list in front of me and I have to get it done, man, we'll just walk right through that list. And one of the things that was building a culture of resilience reminds us to take that step back and inject the compassion component that gratitude helps to inject, and thinking about what are our team members going through, how can we help them. That's excellent. Larissa, thank you for your comment. Larissa is suggesting allowing team members to speak openly about concerns and or ideas without judgment, and being open-minded to new ideas as part of huddles or day-to-day functions. That is so true, Larissa. I love how you bring that forward, because it can be scary to come up with new ideas, but our best ideas really come from the caregivers that are working with the residents day to day, that are experiencing the challenges. They most often have the best ideas on how to come up with a solution. So I love that we should be open, reminding us to do that. And Natasha's asking everyone, how do you have a way that you can circle back with your team and close the loop on new ideas that might come up in huddles? Has anyone used timeouts or resets? Oh, I love that, Dr. Jurovich. That's excellent. Well, this has been some great ideas. Really appreciate it. I'm going to turn this over to Jennifer Lochner. If we could go to the next slide, please. And Jennifer's going to share some best practices from some of our communities.
Thanks, Kathy.
Thank you.
Today we have Emily Dockin, Director of Nursing for Marion Manor Healthcare Center with us. And along with her Assistant Director of Nursing, Emily Schneider, had shared some ideas with us. So I'm going to have them share with you what they do in their facility. So Emily, can you tell us about the Helping Hands Dropbox?
Sure. First of all, the Helping Hands Dropbox is, it was brought to our facility about 2015. I believe our administrator came up with the idea, putting together from a couple other facilities she had worked with in the past. But the Helping Hands is a box, there you can see it in the picture, that's located in one of our central locations. It used to be in our staff lounge, and now it's in our central supply area where all of the staff come in and out throughout the day. It's a program that's basically a way to thank our coworkers for helping us out or for recognizing good work. It's a small thank you card that the employee fills out, and we give that to our coworker that helped them. And there's also a small little slip of paper in the envelope that the giver will put their name on and the receiver's name. So there's two names put onto the card, and those names go into a drawing. And at our quarterly in-service meetings, the administrator will close the meeting by drawing a few names out of the box, a few of the tickets. And if your name is drawn, both the people on the card get a $25 Visa gift card. So sometimes she draws for 4 or 6 cards. Sometimes it's just 2. Sometimes it just kind of depends. But it's just a nice way to show our coworkers that we appreciate their hard work and things that they've helped us out with.
That's a fun idea, especially when there's a chance of more people getting something, receiving something, and feeling like they're appreciated.
Yeah.
For what they're doing. And you also have a sunshine committee. So what's your sunshine committee consist of?
Our sunshine committee was a vision of one of our previous employees, and I think she's actually on the video here somewhere, so she's probably hearing me talk about her. But it is a club or a committee that all staff are invited to become members of. What we do is we tell payroll how much we want to donate out of our paycheck every pay period, and so it's usually like $1 or maybe $2, which is really no big deal for most of us to give away. So that just automatically goes into an account for the Sunshine Committee, and they use it for activities and goodies for the group, for the Sunshine Committee group, or also for other things for all staff. But as far as the members of the group who donate in, we get free t-shirts, gift on our birthday. This year it was a bottle of wine. Last year it was a tote bag. Another year it was a mug filled with your favorite candy. There's a monthly gift basket drawing from the Sunshine Committee for all staff to sign up for. So that sits in our staff lounge with a drawing bucket, and throughout the month, all staff who want to can put their name in the bucket. That gift gets drawn. Last month it was a $50 crumble cookie gift card. Another time it was a gift card for a massage. Another time was a beach cooler, beach towels, and a summertime snack. I won one of those little propane tabletop grills a couple summers ago. The committee has done small games such as turkey bingo, and most recently for St. Patrick's Day, all staff could try their luck to scratch off a ticket. If you got the 4-leaf clover under the little scratch card, you got just a little Debbie snack cake. But if you got a leprechaun, you got a $10 gift certificate to various local businesses. So there were various areas of prizes that you could get for that. If you're on the Sunshine Committee, you get a little sunshine pin to wear to show it's not required to be part of the group, but it's just a nice little extra kind of way for us again to show each other that we're supporting each other.
I love that. And then when you guys had shared that with me too, the picture of your cart reminded me a lot of when I worked in the hospital. We had every Wednesday, our older auxiliary ladies would come and bring snacks and treats for both the patients and the staff. And I looked so forward to that because a lot of days, a lot of shifts that I worked, I didn't get a lunch break. So that snack was my lunch, and at least I got something. So I was really happy to see them.
Yeah, and that cart is just real fun. It randomly, if there's a tough shift or stressful week, or just because the scheduler, she'll bring out the happiness cart, which is, it's decorated real brightly, as you can see. It's got flashing little lights on it, and she'll go up and down the wings and offer snacks and drinks to the staff to show them just gratitude for everything they're doing.
And I bet the residents even like seeing that
They
come up.
do. They do.
Emily, there's a question in chat about how large your facility is.
We're 51 bed.
Thank you.
Thank you.
Mhm.
That's
Thanks for sharing all that.
really a wonderful examples. Thank you all so much for sharing that. It's always wonderful to hear what's happening every day in real life. Dr. Jurovich is sharing that his clinic has a grab bag cart for fresh veggies. I love that. And Nancy McCluskey, let's see, I lost my thing here. So Dr. Jurovich is talking about the clinic has a grab bag cart for fresh veggies and fruits from the staff gardens. That is so much fun. I love that. I love it too when we have gardens in our communities. And then Nancy endorses super methods of gratitude. Marion Manor rocks. You're totally right. That's great. So thank you all so much for sharing these ideas. I really, really appreciate it. Next slide, please. And we'll just take just a couple of minutes here to take this to the next level and hear from the audience today. If you have witnessed or been a part of a successful approach, we've heard a couple of items with examples from Marion Manor and Dr. Jurovich talking about the garden carts. Crystal is sharing that yard games would be fun too, allow staff to get fresh air and have fun. That is a great idea, Crystal. Getting people out and enjoying the outdoors is a great de-stressor and a great team builder. Love that. Are there any other thoughts about ideas or things that you've seen work? I've seen the huddle process work. I've also seen in one of my experiences, we created an opportunity to set the intention for the day, and we called it Gotta Have Heart. We gave everybody a little heart pin, and we had a fun little mantra for them, for all the teams to recite at the beginning of their shift. And that just sort of set the tone of heart and gratitude and caring and compassion. And that helped with building team. Oh, here we have Jessica's suggesting having open talk at the end of staff meetings where you can bring anything to leadership. That's a wonderful idea, Jessica. That's part of that transparency pillar. Linda suggests wellness challenges such as 15 minutes of exercise a day. That's a great idea, Linda. You can actually schedule that into the day, and I've been parts of teams where we would do fun little, not alarms, but like tones that would go over the loudspeaker system that would remind people to do a stretch or to take a minute and take some deep breaths. So there's some ways that you can build in cues to be able to take some good de-stressor activity. Excellent. Well, I really appreciate everything everyone has shared. We thought we'd take one final moment and hear from Emily and just do that summary of approaches so that we can hardwire that for us. Emily, would you like to review again a summary of approaches to support team resilience?
Sure. So as I talked about in the beginning, a strong team has to have like a really good foundation with the pillars, but you also need to have strong individual team members. And in order to do that, the team members have to be practicing their own self-care in their lives. And then that brings that sense of resiliency to the team. So some examples of activities that you can take individual resiliency and kind of scale that up to the team are providing a quiet room for staff to get away during the day, energy boosting treats. I loved hearing about the fresh fruit and veggie cart. The other carts are awesome too. A lot of times we don't get those lunches, and any nutrition we can get in is great. But sharing our own grown fruits and vegetables is really special. spreading positive gossip. We've talked about the gratitude piece again and how that can really help change mindset and really just the tone of the nursing home. Participating in group movement challenges. I talked about the microburst, but there usually are opportunities through your local county or the state level in order to participate in those. If you need any ideas, feel free to reach out to me. Also providing an opportunity for staff to form connections beyond the work walls. A really important piece to creating that team. And then if funds allow, establishing wellness programming to support the individual well-being. But knowing that the right activity is going to look different for each team, each nursing home. So just get really creative and have some fun. You know your staff the best and your team's the best. So just have some fun as you're brainstorming how you might be able to bring this back to your team. If you have any questions, I'll put my email in chat. I'd love to hear more from you. And thanks for letting me be here today.
Thank you so much, Emily, and thank all of you for your contributions. We had a couple of other contributions. Larissa as sharing moments where she's asked individuals in management meetings to say something positive about other managers. Oftentimes that does get overlooked. That is awesome, a great suggestion. And Natasha also talked about the value of huddles before your shift so that it improves collaboration. Those are extremely helpful as well. Thank you all so much. And now we'll turn this back over to Natasha, who will walk us through QAPI and team resilience.
Thank you, Kathy. Let me turn my camera on so you all can see my face. Hello, everybody. All right, let's go ahead and follow up to the next slide. So just a reminder, we do just have a few minutes, so I'm just going to skip through quickly a few slides here so we can get to our evaluation as well. But just as a reminder, for April session, we did ask everybody to go ahead and try to do a huddle. And so if you could type into chat if you guys were able to test out huddles or something comparable to a huddle and what it looked like for you all, how it went, any qualitative information that you had. And we're wondering too, if it's something, did you get a chance to try it? And if you did, will it become a normal part of your routine? Or maybe there's some modifications to the huddle that you're looking for. So if you could start typing that into chat, that would be great. For this month's session, what we're looking for you guys to do, similar to everything that we've talked about so far, is doing a random act of kindness. So we gave quite a few examples of what that can look like. And in the chat, I'll go ahead and post the link to our Google Drive so you can access the PDSA that's already put together for you all. You can print it off or have it available for your team. But again, focus on getting that qualitative feedback to say, hey, did I try something that was suggested as a random act of kindness to your teammates and to your staff, and see if that helped with improving a positive working culture and environment. So let's go ahead and skip to our closing out poll. Rebecca, if you wouldn't mind launching that, and we'll come back to these other slides later. I will hand it back over to Linda as we have this poll read off for you today, but the more information you can give us, the better. We want to make sure that these sessions are meaningful and helpful to you all, and we appreciate everybody joining. And just a reminder, if you want to learn more and share more, please go ahead and stay on for the remainder time of today's session. We are here with our experts. And so we're happy to have you all. Okay, Linda, I'll hand it back over to you.
Okay, thank you, Natasha and Kathy and Emily, everyone on chat who has provided so many really useful tools for building resilience. So here is a slide on our next steps. So please do, if you have time, stay on for a little bit more of an intimate chat about building team resilience and things that you have experienced or questions that you might have. We also encourage everyone to go back and watch the microburst for today's session. Emily gave an overview, but there was so much more information in that than Emily was able to cover. I really was able to take away some really practical ideas of things to do. And then, as Natasha said, we hope that you will start doing one resiliency intervention. She talked about doing a random act of kindness, and I was going to put in chat that one thing that I find so easy to do, and it's always so appreciated, whether I'm doing it or if somebody's doing it for me, is to just write a simple little personal note saying, thank you for whatever it was that somebody did for you the day before. And then we hope that you will plan to complete the microburst for our June session. It will be coming soon, so you'll be hearing more about that. And then we have one more of these sessions, and that will be on June 28th, and that's going to be on community resilience. So we've talked about personal resilience, team resilience, and now we're going to talk about how do we share this not only within our own staff team, but also with the families and the people that are living in the nursing homes where we work. So again, thank you everybody for all the work that you've done so far. And we hope that several of you will be able to stay on and we can continue this conversation. And thank you also for completing the evaluation. This is a slide of the resources that were utilized today. And we will, these slides are posted on the website so you can look at the slides, listen to this session in the, they're being edited currently, and then those resources will also be available. And Natasha just posted a Google Drive where the slides are already placed. So we're getting a lot of information in chat. Would any of you like to come off of mute and talk about any copy that you did last month in regards to resilience, or ideas of how you might do some team building resilience or community building resilience in the coming weeks? Or share experiences that you've had in the past that people might be interested in trying to do in their workplace.
Hi, Linda. Don Jurovich here from North Dakota. And I was just wondering if our quality improvement experts could share their thoughts about how, let's say, you would advise a medical director and the QAPI team how to measure resilience. Are there tools, or what would be a recommendation in terms of identifying the difference, you know, before and after you did a huddle or some other intervention?
I can speak to that if you'd like. There's a couple of different ways that we can measure. So the first one would just be doing a qualitative, something easy to start with, qualitative assessment of your team. And you can ask your team either to give you a number or what they would rate for how they feel resilient as a team, or you can just ask how they're feeling currently, like how things are. And again, it's just qualitative, which just means we're giving a description, words, and just ask them how they're feeling about the way the team is functioning. Because when we talk about resiliency, like you said, it can be challenging to measure. And so we want to get the temperature of the team, how they're feeling, they're functioning as a team. Now, if you were looking for an outcome measure, something that you could do is take a look at how your staff retention is. How many years are your staff members staying? But again, those numbers take a longer time. When we talk about PDSAs, those take a longer time to really show improvement. And so we need to have at least 6 data points to really be able to look at our data and say, yep, when we look at this year, this time we had a percentage of our new staff members who stayed more than a year or left versus a year. And so you could look at your quantitative numbers in that way. But again, those are longer term things that take a longer time to show results. That's why I like to do the qualitative and quantitative assessment. So you get an immediate feedback from your team, like, yes, this is great, this is helpful. And then hopefully in 6 months, you'll be able to see your numbers really show that, hey, we had staff members who stayed, our newer staff who stayed 6 months compared to 3 months, or now we're looking at a year, now we're looking at 5, now we're looking at 10, and our staff is really staying long-term versus seeing a larger percentage leave soon after they're newly hired. So
Thank
I
you,
hope that was
Natasha.
helpful.
That is really helpful and so practical. For any of you who attended our echo sessions a year ago, we actually used a resilience scale that was pretty short that you can give over time. And so that would be another way to measure. And I was going to reach out to Emily to ask her to tell us about, I could not remember the word that was the same as an exit interview, but thank you, Crystal, for putting it into chat. But Crystal mentioned qualitative data collection from stay interviews. And I love that. So rather than waiting until somebody leaves and talking to them about why they left, why not do those interviews all along and find out what is keeping people in their job and what is it that they love. I think that was a wonderful idea. Jessica talked about how she'd like to reach out to the local bowling alley and see if there were a few lanes on a Saturday that the day and evening kind of between crossing over shifts, so the day and evening shifts could come together and bowl a little bit. Emily says surveys that ask if employees are looking for another job or if they have in the last 6 months, and there are those sort of surveys. I will put my name, my email address in chat because I do have some of those in my files. Any other suggestions? How have any of you measured resilience or even just intuitively felt like it's been a positive experience in your facilities?
I think when you go through like a really, say, a hard loss or a really hard day, and the team comes together and nobody's talking of quitting, or the team really pulls together through that and maybe can have a debrief and comes out stronger on the other side, I think then you know that that team is pretty strong.
I agree. Thank you, Emily. Natasha, could you elaborate a little bit on focusing on the safe culture and how that can impact resilience? Putting you on the spot.
Absolutely. Absolutely. No, not a problem. I think most pretty much kind of know what a safe culture means. And it's just having that atmosphere where if someone is having a rough day, they feel comfortable and safe that they can talk about it with either other colleagues or their leadership staff. And sometimes we don't really know that we haven't created a safe culture. And sometimes it just takes us coming to staff and that follow through with that communication once it's had with us, that they know and they can learn, because I'm sure they've had barriers in the past that have prevented them for feeling safe. And in a psychologically safe environment where they can share, I'm having barriers. Like I loved hearing from the nursing home that shared about the fact that someone had an idea and they implemented it, having that closed loop, like you brought a problem or you identified a problem, you came with an idea, which is what we want from everybody, not to just have the challenges, but an idea or an opportunity for improvement. And then having leadership listen, hear it, and say, yes, that is a great idea. And then they implemented a version of it. And so I think having that safe environment where you say that it's a safe environment, you welcome them, you promote that it's a safe environment, and then you close the loop and show them that, yes, you communicating this with me, I heard you. I think I saw that from Emily in the chat, that they felt heard and they felt like you were doing something actively to try to improve on it. And I think that can be really challenging to really have that environment just be safe. And even if leadership is a safe environment, the whole team may not be. So by being a leader and sharing that it's a safe environment, it's more likely that that will diffuse down into your team as well. And it'll just be a safe environment for everybody to openly communicate.
Thank you. And when you talk about that, I think about for leadership that transparency can be a little vulnerable, right? Mm-hmm. But modeling vulnerability in leadership is great because then that allows everyone to be able to express vulnerability. One suggestion I heard once was, as we talk about sharing 3 good things, but also to just share how we really are today. So, you come in and it's like, oh, one of my kids is sick and I really had to take him over to my mother-in-law's and I'm worried about it. And so just sharing that with the team so that people know that this is what somebody's got on their mind while they're trying to do their work for the day. And that allows us to support each other.
Linda, I think those are awesome ideas, and the transparency piece is so critical. I also I love how this is so positively focused and looking for the positive and sharing the gratitude. As leaders, I think we do need to be sensitive to early indicators that could indicate that the stress level of our team might be going up. And I've always used the residents' feedback on the care, our clients, our residents, on what's happening in the facility, and are they experiencing positivity? Are they experiencing some challenges with the team? Are you seeing an increase in numbers of concerns, an increase in numbers of grievances? Those can be indicators something else is brewing, and a great way to do earlier intervention before it becomes maybe even more amassed in the facility. So always staying positive, keeping everyone on a positive note, allowing transparency, but also being aware of indicators that things might be fraying at the edges, and doing early interventions.
Thank you, Kathy. And Larissa adds that sometimes there are staff members that are more connected with other staff members. So utilizing them as resources is also very helpful. Getting them on your team and helping them to spread that transparency and that gratitude. Don posted a copy run. Chart measurement may be simply documenting weekly staff comments. For example, the total number and percentage of staff who commented with expectations. And that by making that public about the percentage and the number that have shared, then maybe that makes the more quiet staff members feel like it is safe for them to express their ideas and their opinions. And Natasha brought up, oh, go ahead, Don.
Yeah, sorry, Linda. I just wanted to, just follow up with that comment that, while we look for, quality, issues that just simply engagement. So that would be an engagement chart, that you could, work on. And, I suppose a lot of us understand the people that typically are quiet and don't speak up in the room. And so as a team and as a measurement, if we get some of those people then to engage, I think that's a pretty good barometer of team building and team resilience. So again, that could just be a very, very simple measure that you could use either from your huddles or from group meetings or however, if you convene weekly or however you bring the teams together. So yeah.
Thank you. That's an excellent suggestion. We have a couple of more great suggestions from Natasha and Emily. Natasha says that a good step is always identifying if the behavior is human error versus risk-taking. For human error, we look at the processes, and risky behavior is addressed by coaching. And so being able to have leadership that has the time to do that and that has the experience to do that would be really important. And Emily talks about using seasoned team members to mentor newer team members. And, I think that's so important in today's healthcare climate where we have so much turnover. And so really looking at the people that have been there for a while. I mean, it may not even be very long, but they have experienced more than the newer team members, and helping them advise and mentor those younger team members. And also it helps them become more aware of the culture, of the workplace culture as well. And that's a lot of kudos for those ideas. Any other suggestions or things that people have tried?
I would expand on the mentoring piece a little bit. I think especially with the VOT trial, there's a real concern about patient safety and, reporting, and I think when you've got maybe an older nurse like myself that, grew up in the time and worked in the time of, you easily reported yourself if there was an issue or an error, and just normalizing that and trying to make sure that piece for our resident safety, I'm hopeful that can help kind of normalize it and take some of that fear factor out, contributing to the safe culture.
Piggybacking off your patient safety, what I would do in the hospital that I worked at when I was in the management position in quality, I could hear outside of my office some of the CNAs talking about, I have so much stuff to do and we have all these lift residents, and I'd go out in the hall and say, if you need your second person to help with a transfer with a lift, come and grab me. If everyone's busy, grab me. And I think they felt better knowing that management was willing to go out and do some patient care with them. And also that was the time of, you could do some competencies, seeing if they know how to use those lifts correctly. And it's also a teaching moment too. So, and those residents and patients would get to see you out of your office and not in your office all the time working on that stuff. You felt more of part of a team and working together as a team.
Thank you. Any other suggestions or comments? Natasha just said, so many times I would hear how frontline staff would appreciate having leadership work the floor to understand what they are going through. I think that really fits with the trust aspect of those 5 pillars that Emily talked about as well.
Can I add one thing, and I'm not sure how I will write it. This is Larissa again. I think as when I worked at the nursing home where I came from, I think management also sometimes try to hold this brave front, this, this attitude that sometimes showing our own vulnerability, I think sometimes encourages staff to also share. We're not always in, perfect mood or perfect headspace or got our stuff together. And so sharing that sometimes actually kind of gave a very positive outcome as well.
Thank you for that, Larissa. That importance of being authentic and embracing some of those tenets of authentic leadership. Yeah, and Catherine talks about important for management or leadership to be walking around and out in the front lines. And sorry, I interrupted someone.
Oh no, this is Kathy. I was just probably interrupting you, so I'm sorry. But I don't know if anyone's heard of Brene Brown's work. She's done quite a bit she's a lot of TED Talks online about vulnerability and leadership and the importance of being vulnerable when you are in leadership roles. And it's just, I think it's a really important example of how to connect with employees, because we're all in this together, and point out that people shift roles within the facility, and point out that really solid leaders are also solid followers and allow other people to be leaders. So there's like that role exchange that can occur. But that vulnerability piece, I was highly impressed with Brene Brown's work on that.
I agree, Kathy. I've read everything she's written, and if you aren't familiar with her, I'm going to put her name in chat. But she has, I think it's the most popular TED Talk ever. Has had the most views on vulnerability, but she has also written extensively on vulnerability and daring to lead, and that idea that we often don't see ourselves as leaders, but we come into these leadership positions, and that being able to lead and being vulnerable to lead wherever we are.
I'm going to take a stab at being vulnerable here for a second and share that it was her work that helped me come to terms with some of the challenges that we face, especially in the skilled nursing, post-acute long-term care world. I've worked in all aspects of healthcare, and we are the most regulated. And at times it can feel very overwhelming on how to be able to be in compliance with all the regulations all the time. And when there's one thing that gets missed and it has implications, it can be very difficult for the leadership of the facility to be able to manage through that. And I found Brene Brown's work to help give me permission as a leader to say, you know, this is hard work. We have to do this as a team. We'll get through it. We don't, a mishap or a misstep doesn't necessarily define ourselves as individuals or as a team. I do think that this discussion does need to recognize the challenges of the compliance end of what we do. And it is never ending, highly intense, always present. And the roles of the leaders in our skilled nursing facilities and long-term care facilities, they're 24/7 roles. And you are on during the day, and you also get the call at midnight when there's been a fall with a fracture. And so it's just a constant, there's a constancy of that intensity in this work. And being able to lead while still being vulnerable is not an easy task. So my hat's off to everyone's on the call who has sustained with this work, because there is just, it's very important work. The regulations keep us in line with the standards of practice, and that's a very important function of the regulations. And as a leader, it is important to be transparent with your team and to call upon them to be part of the team to resolve the concerns that might come up. So it's an interesting environment we practice in, but an important one.
Thank you, Kathy. And we've talked in the past about how it can all seem that we're just focusing on the punitive aspects, what's been done not correctly. And I think what I have loved about this webinar series is that we have focused on the positive. What are the things that we are doing well as a team? And so kudos to everyone for all that they have shared to help us see the good things about this work and the strengths that our teams have. Any other comments? Natasha, 100%. Keep positive at the front. Maybe we should have some t-shirts made up or something at the end of this. Well, if there are no other comments, I just want to say thank you so much for attending and sharing today. And we look forward to seeing you in June. Stay tuned for when that next microburst will be available. Think about the QAPI project for the month and doing the random acts of kindness. And we look forward to meeting with you next month and hearing about your successes. And have a wonderful Memorial Day weekend.